the connective tissue, promotes the growth and the recovery of the collagen and the tissues. Then we have the glutamine with an anti-catabolic effect. Hyaluronic acid that will moisturize the skin, so we'll see also nice results for treatment of seborrhea, and arginine that stabilizes structure of dermal proteins. We have the biotin that will decrease the sebum production, so some treatments that they have oily hair, they are very happy with that treatment also. We have the matrixil that accelerates the hair growth, so that is one of the first things the patient will notice, that they have more body in their hair. Then we have the copper peptide and the zinc. The copper peptide promotes the cell proliferation and facilitates the protein synthesis, specifically the keratin. And in the past we couldn't put it together with the zinc, so we got formulas that they were or with copper peptide or with zinc, because they are both competitors for the same receptor to cellular level. Thanks to the check technology, first we are going to have the action of one, and afterwards the other one. So we're going to have complementary action and a better result. The vitamins of the group B, that they are stimulating the blood circulation. As you know, other medications in the market, they also work on that way. A better blood circulation will help to have a better hair follicles recovery, but also interesting that restores the natural hair pigment. So for early graying of the hair, we can also have a nice result. The rutin also strengthens the vascular wall, and we can see that the zinc and the copper, we can put them together. Both of them with different actions on the follicle, but combined we have a very strong effect. The indications, well, diffuse alopecia, alopecia areata, seborrhea, early graying of the hair, always when we are talking with non-cicatricial alopecia. So any type of non-cicatricial alopecia. With cicatricial alopecia, I really don't recommend you to do any sort of mesotherapy or treatment, because we can make it much worse. The recommendations is 6 procedures. In the box there are coming 6 bottles, so with one box you have enough for one treatment, and the protocol is one treatment every 2 weeks. Then we can do maintenance depending on the type of alopecia. Every 1 or 1.5, 2 months, we can do 1 session just to maintain. The hairline results we're going to have, we're going to prevent the hair loss, we're going to strengthen the hair follicle, we're going to improve the quality of the hair. That's the thing that people, it's the first thing they're going to notice. So patients, they are very happy with that. The pigmentation is also a thing we are going to see, but it will come a little bit later, and the cell regulation. Let's go and see some results. Here we have before and after. We have a thicker hair, a healthier hair, much better structure. This is one of my cases. This is a patient with alopecia areata. This was a case report. Only after 2 sessions, we saw the recovery of the hair follicles. This is another case. You can see also the pigmentation improved. We have this recovery of the graying of the hair, much more density and better quality of the hair. This was after 6 sessions, according to the protocol. And here we have a man. I also want to be clear with one thing. If we don't have follicles, we cannot stimulate them. So we have also with people that they completely lost the follicle. To do mesotherapy on that area doesn't have any sense. But to maintain, for example, in that case, we could recover better density, also better color of the hair, but the areas, the little areas that was not any hair follicle, we didn't recuperate. The same on that case. While still hair, we can treat it. The best approach for me is an early treatment. How younger we treat the patient, better results we are going to have. So I'm going to go to demonstrate now, and afterwards I will come back for some questions. Thank you very much. I use with a derma pen, so I simply put a few drops of the product and with the derma pen 0.5 millimeters depth. Then we do a little treatment to allow the product to penetrate into the skin. I get a lot of questions about which one is the correct depth. So the correct depth is 0.5 when we are doing hair recovery. If we are treating something like cellulitis or other things, we have to go deeper. So we can go to 1.5 to 2 millimeters when we are treating the legs. But for the scalp area, the best is 0.5. And it's a treatment that can be done very quickly. And we don't have any recovery needed for that. We can do the treatment, and the only thing I recommend to come with the hair clean, and we can wash it. We must wash it after 24 hours. But the same day, don't go to sauna, don't go to hammam, for example, don't go to warm places, and try not to put water on it. Don't go to the swimming pool or something, because we could go and have little infection. But if you use this simple trick, the patient comes with the hair clean, and we don't make it moist. For 24 hours, is no problem at all. This treatment is also not painful. So I don't know if you have any question for me, because I think it's not complicated treatment to do.
Question, yes.
Simply mention that for hair recovery, the proper depth is 0.5.
Hold on, I'll give you the mic. It's better that way and faster. We've got a question for you, Dr. Siquier.
Yeah.
Yes, doctor, you mentioned that for hair recovery, the proper depth is 0.5. For other conditions, 1.5 to 2.0.
Yeah.
What about for treating gray hair?
The gray hair it will be the same depth. So it's where we want the depth we want the product to penetrate. So it has to be 0.5. If we do it deeper, we will have probably less result, because the product will spread to deeper layers. So we want that it stays in the skin, and we also this microneedling device will allow us that if we left a little bit product, we have a little bit extra product, like I'm going to show you now. You can simply massage a little bit, and we leave it there, will penetrate slowly afterwards. But it's for other indications. What you're looking, if you're treating, and also other types of skin. It's not the same treating the body. So, for example, for skin line, we have nice results on the legs, but we have to work a little bit deeper. For the hair, 0.5 is the best indication. And now, one thing that you have to take in consideration, if you're treating other areas, for example, if you're treating alopecia areata on the beard, you will have a result much faster. But if you are treating alopecia on the eyebrows, for example, you will have a result much later, because the follicle cycle is different on every area, but the depth will be the same. Thank you very much for your question. I'm going to go back.